This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, great. So I'm Dr. Kiramati. Thank you for the introduction. Thank you for PM&R Scholars for inviting us here today. I am the program director for the Sinai Hospital of Baltimore PM&R Residency Program. I'm going to share my screen. I have a short presentation. I'm also joined by my junior chief, Dr. Majmudar. So after the presentation, I'll see if he has anything else to add, and then we'll open it up to questions. Just give me a moment to share, and let me open this up to full screen mode. All right. So again, we are Sinai Hospital of Baltimore. We are in association with the University of Maryland Medical System. So we do have several rotation sites within the University of Maryland Medical System, and we'll go through that during this presentation. We are a kind of medium to smaller-ish program. We do not have a categorical year, so we start as a PGY2 year. We have 4 residents a year, and so that's 12 residents total. We have a junior chief and a senior chief. During our PGY2 year, we have the residents kind of vote on one of the PGY2s to become junior chief the following year, and then that person will then go on to be the senior chief during their PGY4 year. We actually have 2 junior chiefs this year. We did have a tie in the voting. Our other chiefs are not available today, but we do have one of them for questions. So our rotations are scheduled in 3-month blocks. So I'm going to review that with you, starting with our PGY2 year. So with each of the 3-month blocks, it's going to be a certain kind of focus that the resident's going to be like working on. So our PGY2 year is a bit more inpatient heavy. We do have pretty much 9 months of inpatient acute rehab. This 3-month block is general rehab. That's with our attending Dr. Chang. She sees primarily debility. We also have some cancer patients on that unit, some cardiac patients like status post-CABG, some pulmonary. So that'll be roughly her patient population and that rotation. Another inpatient rotation is with Dr. Manfredo. That's on our inpatient rehab neuro unit. That's going to be mostly strokes, but he'll also have other neurodiagnoses like multiple sclerosis or CIDP, which is just another name for Guillain-Barré. And then we have another 3-month inpatient acute rehab rotation on the ortho rehab unit. That's with Dr. Tannen. His patient population is mostly hip and knee replacements, but he also will have some cervical and lumbar fusions on his patient load as well. So the general and ortho units are combined in our hospital. All of our inpatient units at Sinai are embedded within the hospital. The nice thing about that is we do have quick access to all the specialties. So if we have a medical emergency on one of our patients, our hospital is able to have us call what we call a rapid response, and then we're able to have the medical team come to the patient's bedside very quickly. We have cardiology available, pulmonology, all the GI, all the other services too. So that can make it very easy for us to get the care that our patients need. We also have this rotation that I highlighted. It's Sinai A. That's an outpatient rotation during the PGY2 year. That is a combination of working with 3 different attendings, one of them being Scott Brown, who is the chief of our department. We like having him pretty early in the residence experience so that they can work with the chief and get some of his knowledge from all of his experience. His outpatient clinic is a multidisciplinary prosthetics clinic. So he works in combination with the prosthetist as well as the physical therapist. So all of these providers come to the clinic, they see the patient together to come up with recommendations. The other 2 attendings are Dr. Staggs. She sees a combination of patient population. She has chronic pain. She does some Botox injections. She does some EMGs. She also has some outpatient cancer and lymphedema patients. And then we also have Dr. Harrison. She also does more general outpatient rehab, combination of more of the chronic pain, as well as Botox injections, mostly Botox for migraines. And she also has a specialization in integrative medicine. So she does have a clinic where she does focus on that. All right, moving on to our PGY3 year, a little bit less inpatient acute rehab. So it's going to be more outpatient. So we have a block at our Baltimore VA that is all outpatient. It's going to be a combination of doing some MSK, some kind of general pain, as well as there's a wheelchair clinic, and there's also a spinal cord injury clinic. With the spinal cord injury clinic, the residents do get opportunities to do pump refills and further Botox injections. UMROI, that stands for University of Maryland Rehab and Orthopedic Institute. That is a standalone rehab hospital affiliated with University of Maryland. We have our residents go to the spinal cord injury unit for that. So that is an acute inpatient spinal cord injury experience. So there'll be 3 months of that. And then we have some further outpatient rotations. Sinai C is going to be doing some outpatient neuro rehab with myself and Dr. Wong, and doing interventional pain with our attending Dr. Lee. Sinai B is going to be doing some EMGs as well as some sports medicine. We do have a dedicated elective month for the resident, and the resident can do really whatever they see fit for that month. A lot of our residents, especially if they decide that they want to do fellowship, end up using that elective month to do audition rotations. And they can split that up however they want. They may do like 2 weeks at an institution and another 2 weeks elsewhere. It's really their choice. Some decide to spend half the time at a different institution, maybe half of the time more so at Sinai with one of our other attendings. Some decide to use that for more research time. Maybe about 3 years ago, we did have a resident who ended up doing a international rotation for her elective month. So that is an opportunity that our residents can use. PGY 4 year, again, we have another elective month that the resident can spend however they wish. We have that coupled with our 2 pediatric months. One is at Kennedy Krieger, that is all outpatient, and Kennedy Krieger is actually affiliated with Hopkins. And then we also have a month at Mount Washington Pediatric Hospital, which will be a combination of inpatient and outpatient pediatrics. We have 3 months on our TBI unit. That's here at Sinai. That's acute inpatient TBI with Dr. Wong. And she'll kind of see a combination of some trauma TBI, but may also have some hemorrhagic strokes that are on her unit as well. We have 3 months at Walter Reed Medical Center, and that's doing EMGs every day in and day out. So our residents have no problem hitting all the number requirements for ACG&E doing EMGs. This rotation site is a bit further from our home institution at Sinai. For those that are unfamiliar with our geographical location, Sinai is just the north part of Baltimore. Walter Reed is in Bethesda, Maryland, which is closer towards DC. So it's probably a little bit over an hour commute one way. That is, again, our furthest site. All of the other rotation sites are within 20 minutes of our home institution. And then we also have another outpatient rotation, which we call Sinai D, which is going to be a combination of doing some sports medicine with Dr. Amin, who's a University of Maryland physician, as well as Dr. Press Bravo, who does interventional pain. Okay, so I kind of mentioned all these already, but these are our rotation sites. We'll go through them again. So we have University of Maryland, we have an orthopedic institute. For those who might be from the area, it was formerly known as Kernan. That's quite a staple of our community. It is a standalone rehab hospital that is affiliated with University of Maryland. And our residents only spend time on the spinal cord injury unit during those 3 months while they're there. And we also have the Baltimore VA, which is actually associated with University of Maryland as well. And those are the types of rotation experiences that our residents have on that rotation. And again, the pediatric rotations, one will be at Candy Krieger, and then the other would be at Mount Washington Pediatric Hospital. And for this rotation site, Walter Reed Medical Center, that is down in Bethesda, Maryland, doing EMGs. And just some information for anyone who is interested in spending some one-on-one time with us. We do offer elective rotations, either 2 weeks or 4 weeks. This would be the best way to get a hold of us to inquire about that. And really, that is the best way to really show how awesome you are to us and get a feel of if we're a good fit for you. So I'm going to stop sharing and give Dr. Majmudar opportunity to speak if he has anything else to add.
Hi, everyone. Thank you so much, Dr. Karamati. The only things I want to add is, as Dr. Karamati said, we have a very small program, but we're all really like a family. So just to add about the atmosphere of our program, we all really take care of each other. There's a lot of opportunities for learning in our didactics on Wednesdays. And we'll all stay back and teach each other some ultrasound or some EMG. And in terms of our call or other areas, we'll always sort of take care of each other and handle our schedules accordingly. Another great part of our program is the vacation time is sort of decided at the beginning of each rotation for us. So we don't have to decide a year in advance, which is really great. So you can decide only a couple months in advance and kind of discuss with your attending. And it's all attending dependent on who you're working with in your 3-month block, which is really nice. And that's a benefit of our program as well. Those are just a few things I wanted to bring up. If you guys have any further questions, please drop them in the chat, or you can ask over here and we'll be willing to answer them.
Great, thank you. And I guess we'll kind of like just peek in the chat, see if there's any questions we can answer.
Just the most recent question, we do have a pediatric rehabilitation blocks. During our 4th year, we spend 2 months with Kennedy Krieger Institute in Baltimore, as well as Mount Washington Hospital as well. So we have 2 months of dedicated time with pediatric rehab. In terms of our call schedule, so our calls around, for PGY 2-year, you're probably on call about 4 times a month, 4 to 5 times a month. And then PGY 3-year, you're probably on call about twice a month. And then PGY 4-year, you're not on call at all. Our calls are in-house, which is really good because you have a post-call day. So they're really front-loaded because when we have, as Dr. Karamati said, we have a lot of inpatient rotations our first year. So you're going to be on call on the inpatient sites. So you'll know the patients a lot better as well. And as you go in with your time, your calls really decrease. Like I said, about 4 or 5 a month, your PGY 2 to 2 a month, PGY 3 to no call, virtually no call in your PGY 4-year. That's our schedule set up. Technology and innovation projects in our program. We're always working with our pain management, interventional pain physicians and attendings on some sort of like research and innovation projects. Our pain management, one of our attendings, Dr. Lee, actually co-wrote the ultrasound book for ultrasound guided procedures for interventional pain that's used by NAS. So he's always doing new projects. We also do a lot of sort of tech projects with some of our attendings. It just depends on who's doing. There's nothing program specific right now, but we do have a lot of quality QI type projects kind of in the works currently.
And then just to piggyback on some of the things Dr. Majmudar said, we do have Lumifies that we have purchased specifically just for residents to utilize for ultrasound practice. So those that are not familiar with that, Lumifies are just the portable ultrasound devices, and you just kind of plug it to a little iPad, or we have the Samsung tablets, and then it's available to the residents all the time while they're on campus at Sinai. We also have a gait lab. We have a new PhD researcher who does research in gait for pediatric population. So we're happy to have her and utilizing our gait lab and her own personal lab. So we do have that as well for our patients and for potential research. Other thing about call, just to kind of clarify, we do have 2 inpatient rehab units. One unit is 23 beds total. That's our general and ortho unit. And then our neuro and TBI unit is 20 beds total. So you are never covering more than 43 patients total. And it would only be covering the rehab patients that are on those units. It happens that we'll sometimes have overflow from the acute care that they'll use one of our beds. They are not our patients. Our residents do not cover those patients. We do have a call room that is right next to the units for the resident to sleep, rest. There's a shower and all that sort of stuff in there too.
I see a question about required research for graduation. We do have a research requirement on graduation. Dr. Karamati can expand on that. But we also have dedicated journal club about once a month as well that we do. And we have a research day at the end of the year, and then Dr. Karamati can further clarify on the research.
Yeah, we'll do. So our research requirement, and this is kind of coming mostly from the ACGME, is to have a poster that's presented at least in a state or national conference, which is what the vast majority of our residents do. And they can be any author. They could be first author, second author, third author, or whatever, as long as that poster is presented at a state or national conference. That will be enough to meet our requirements. Our residents can do definitely more than that. They can go on to do publications if they wish. The other requirement to satisfy would be potentially writing a book or a chapter in a book. We haven't really had any residents do that in the past couple years, but that is another option to fulfill that research requirement. We do have our residents do like a mini research rotation with our PhD researcher during their PGY 2 year. It's just a 2-week rotation. Really kind of delving into how you would go about writing out hypothesis, getting data, so on and so forth, getting IRB approval. So it's kind of like doing a research project in like fast forward and kind of like just do it all super quickly. And going to be a good opportunity for whoever really wants to start a specific project to get it jump started during that time, and then they can work on it throughout the rest of the residency. Just like Dr. Majmudar mentioned, we do have journal club, and that is once a month during our didactics. One of the residents will present an article and we will appraise it along with the PhD researcher. So we really have delved in quite a bit into the nitty-gritty of articles with that.
I think we have one. Okay, thank you. Resident education, our didactics are protected every Wednesday from 8 a.m. to 12 p.m. And we usually get a little bit of time for lunch after that. During that time, we are not expected to round on patients. If you are inpatient, your attending will write the notes for that day. And if you're working in an outside facility, the outside facility is known that you are not expected back until 1 p.m. that day. for your after your resident protected time for that. And in terms of conferences, so we actually this is one thing I love about our program. Our program supports conferences, supports resident conferences. If you are a first or second author on a poster presentation or a case report or anything else, you can get reimbursement. Dr. Kirmani, I believe it's up to $2,000. Is that correct?
Yep, correct.
It's up to $2,000 in reimbursement. I specifically went to Orlando this year at AAP and I had a poster presentation, and it was really fun. We presented our posters, we went to the conferences, and then our free time, we had some downtime to have fun in Orlando as well.
Yeah,
I think
and
there
that
was,
would just be $2,000 for one conference per academic year for that resident.
so you kind of pick and choose what conference you want to go to if you're what you're interested in and go from there. I think I saw a question about whether the program is IMG friendly. I think another person is asking that as well. I just want to say we have had IMGs matched in our program in the past. Our most current chief, who just graduated, was an IMG, and he actually just matched sports medicine in Tampa Bay. He's currently a sports medicine fellow. So we have had IMGs in the past.
Thank you to Sinai Baltimore for being here this evening. We sincerely appreciate it.